Hi everyone, welcome back to the channel. Today we're talking about a fascinating and sometimes controversial anti-seizure medicine called Perampanel, also known by its brand name Fycompa. It's used to treat epilepsy and partial or generalized seizures, but many people don't realize it also affects mood, energy, and even how you experience sleep. It's one of those new generation drugs, powerful, precise, and sometimes unpredictable. Before we start, please remember, this video is for educational purposes only. I'm not a doctor and this isn't medical advice. Always discuss your personal situation and treatment plan with your neurologist or healthcare provider. Now let's dive into the 5 big effects of Perampanel, what makes it so unique, and what you must know before taking it. Effect 1. The calm after the storm. Seizure control. For people living with epilepsy, even one seizure can turn life upside down. That's where Perampanel comes in. It's designed to calm the electrical storms inside the brain. Unlike older anti-seizure drugs that focus mainly on GABA or sodium channels, Perampanel works on AMPA receptors. These are the brain's excitatory switches that control communication between neurons. When those receptors fire too much, the brain becomes overstimulated, leading to seizures. By blocking those receptors, Perampanel helps stabilize brain activity, almost like turning down the volume on an overactive signal. Many users describe the feeling as "my brain finally went quiet." It doesn't stop all seizures overnight, but over time, the brain begins to find its rhythm again. In clinical trials, many patients experienced fewer and milder seizures, sometimes after years of instability. That's why Perampanel is seen as a breakthrough for those who haven't found relief with older meds. Effect 2. Drowsiness, dizziness, and AMP balance problems. Now let's talk about the side that most users feel first: drowsiness, dizziness, and coordination issues. In the first few weeks, your brain and body are adjusting to new electrical patterns. Some people say they feel drunk, lightheaded, or like they're walking on a boat. This is normal, because Perampanel slows down the hyperactivity in brain cells that also control movement and balance. That's why doctors usually recommend taking it at night before going to bed and avoiding driving or climbing stairs until you know how it affects you. These effects often fade after a few weeks, but if they don't, your doctor might lower the dose or space out the timing. Remember, slow and steady is key with this medicine. Effect 3. Mood swings, irritability, and AMP, aggression. This is the most shocking and important effect to understand. Perampanel can affect mood and behavior, sometimes leading to anger, irritability, or aggression, even in people who've never experienced that before. The reason? It changes how certain areas of the brain handle emotional impulses and self-control. In a small percentage of users, this shift can release anger or frustration unexpectedly. Families sometimes notice it before the person taking the drug does. They may become snappy, short-tempered, or restless. It's rare, but when it happens, it must be taken seriously. Doctors usually monitor for this effect, especially during the first few months. If you notice big personality changes or anger outbursts, never ignore them. Talk to your healthcare provider immediately. Adjusting the dose can usually solve the problem before it escalates. Effect 4. Deep sleep, grogginess, and AMP, dream changes. Perampanel has a very long half-life. It stays in your body for almost a full day. That's why it's designed as a once-daily night dose. Many people report deeper sleep, vivid dreams, or waking up feeling heavy and groggy. Some even say they remember dreams more clearly, as if their brain is stuck in dream mode. This happens because Perampanel also calms brain areas that control sleep cycles and REM activity. If you wake up foggy or slow, try taking your dose slightly earlier in the evening, say 2 hours before bed, and make sure you're sleeping at least 7 to 8 hours. For most people, the grogginess fades as their body adapts. Effect 5. Long-term balance and AMP quality of life. Over time, Perampanel can truly stabilize life for people with epilepsy or seizure disorders. It's not just about fewer seizures, it's about confidence, clarity, and independence. Imagine being able to sleep through the night without fear of waking up disoriented or seizing. That's the power of stability. However, long-term use needs monitoring. Doctors usually check liver function, balance, coordination, and mental health. Because the same calm that brings relief can sometimes cause subtle side effects over time. Used properly and carefully adjusted, Perampanel can bring a calmer mind and safer daily life. So, to wrap it all up, Perampanel, Fycompa, is a next-gen anti-seizure drug that works by quieting brain overactivity through AMPA receptor blocking. It can cause sleepiness, dizziness, mood changes, or balance problems, especially early on. Over time, it can bring incredible calm, seizure control, and a new sense of normal when used under proper supervision. If you're starting this medicine, give your body time to adjust. Stay patient, keep communication open with your doctor, and never stop it suddenly. If you found this video helpful, give it a thumbs up, subscribe, and share it with someone who might need this information. Stay safe, stay balanced, and take care of your mind.